Hi everyone, I hope you will be in best of your health. In this video I will tell you about diethylstilbestrol exposure and cancer. And we will clear all our queries about diethylstilbestrol or DES. What is DES? Diethylstilbestrol, DES, is a synthetic form of the female hormone estrogen. It was prescribed to pregnant women between 1940 and 1971 to prevent miscarriage, premature labor, and related complications of pregnancy. In 1971, researchers linked prenatal, while in the womb, or in utero, DES exposure to a type of cancer of the cervix and vagina called clear cell adenocarcinoma in a small group of women. DES is now known to be an endocrine disrupting chemical, one of a number of substances that interfere with the endocrine system to potentially cause cancer, birth defects, and other developmental abnormalities. What is the cancer risk of people who were exposed to DES in utero? However, females exposed to DES in utero, commonly called DES daughters, are at increased risk of several specific cancers, including Number 1 clear cell adenocarcinoma. DES daughters have about 40 times the risk of developing clear cell adenocarcinoma of the lower genital tract as unexposed women who were not exposed to DES prenatally. The first DES daughters with clear cell adenocarcinoma were very young at the time of their diagnoses. Number 2, breast cancer. Number 3, pancreatic cancer. A 2021 study found that DES daughters had about 2 times the risk of pancreatic cancer as women in the general population. Number 4, cervical precancers. Studies show that DES daughters were about 2 times more likely to have high-grade cell changes in the cervix than females not exposed to DES in utero. Approximately 4% of DES daughters developed these conditions because of their exposure. Do the children of women who took DES have problems with fertility and pregnancy? Several studies have found increased risks of premature birth, miscarriage, and ectopic pregnancy in females exposed to DES in utero. Some studies suggest that the increased risk of infertility in DES daughters is due mainly to uterine or fallopian tube problems. Males exposed to DES in utero have an increased risk of testicular abnormalities, including undescended testicles or development of cysts in the epididymis. There is also some evidence of increased risks of inflammation or infection of the testicles. However, DES sons do not have an increased risk of infertility, even when they have genital abnormalities. What other health issues or characteristics might DES daughters and DES sons have? People who were exposed to DES in utero may have other health issues or characteristics, including Number 1, cardiovascular disease. Individuals exposed to DES have an increased risk of high cholesterol, hypertension, coronary artery disease, and heart attack but not of stroke. The associations between prenatal DES exposure and coronary artery disease and heart attack appear to be stronger in DES daughters than DES sons. Number 2, early menopause. Scientists estimate that 3% of DES-exposed women have experienced early menopause due to their exposure. Number 3, psychosexual characteristics. Findings from animal studies have raised the possibility that prenatal exposure to DES may influence certain psychological and sexual characteristics of adult men and women. A study published in 2020 found that DES daughters were about 40% less likely to identify as gay, lesbian or bisexual compared with unexposed women. There were indications that DES-exposed men were more likely to be gay or bisexual, but these associations were not statistically significant. What should DES daughters do? Women who know or believe they were exposed to DES before birth should be aware of the health effects of DES and inform their healthcare provider about their possible exposure. These individuals have generally been advised to have an annual medical examination to check for adverse health effects of DES, including abnormal cervical cells and clear cell adenocarcinoma. However, now that the population of DES daughters has become older, the youngest having been born in 1972, the relative benefits and harms of this approach compared with what is recommended for DES unexposed individuals is unclear. This was all about DES and cancer related to DES therapy. If really enjoyed the information, do subscribe this channel. See you in the next video. Till then, take best care.